Hello, I'm Ed Gordon. The 2020 presidential election is only weeks away. Many have called this election crucial to saving democracy as we know it. For the next 4 weeks leading into Election Day, we'll have specials that look at specific issues and will connect the dots as to why it's so important for you to vote. This election will affect your life for many years to come. Today, we'll start with a look at the health of Black America. Up next on Impact the Vote. Before we get into the question of voting for your health, we're now joined by Bishop Wayne T. Jackson, founder and CEO of the Impact Network. Bishop, welcome.
Good to be here, Ed.
Let me ask you, why did you deem it so important to put on this series of programs?
Well, because voting is so important. I feel that I can go as far as saying that it's sacred in my eyes, because blood has been shed, lives have been lost, violence has been on our forefathers and mothers who fought for voting rights, and for African Americans especially. And you know, I feel that we need to make sure that we can get a message out to our people that every vote counts, and understanding that it is important that we exercise that right that's been given to us.
Bishop, one of the things we like to say during election time in our community is take your souls to the polls.
Yeah.
And during COVID, we've not been able to see that visit of the politician, the traditional visit to Black churches. Yeah. This, in some degree, will service that, will it not?
Oh, yeah. You know, I've been pastoring that over 30-something years, 3 decades. And out of all those years, I found out there's 2 things that politicians want, and that's your vote and your money. And I said that to say this, is that they come to the ministries, and they come and they want the endorsement of that local pastor, and then they want the people that's sitting in the pews to vote for them, and also help them, support them with their finances. This Impact Network is in over 90 million homes, helping 90 million home reach through cable and satellite. And now they can't come. It's unorthodox now. You know, it's a different game now. And they can't come to the ministries and stand in the pulpit by the pastors and say that, you know, I'm going to do this and do that for you. This now Impact allows our community to hear, you know, what's going on, and they can make up their own minds.
Finally, we should note that being Black owned, it's important for us to be able to control our narrative.
Yes. And that's what Impact is all about. And the reason that Impact was formed was because we didn't have that in the faith community. We 100% owned and operated by us. So these type of topics and what we're doing with this special with you and our guests, it allows us not to get a 30-second bite, an edited type of version where people set their own narrative. We can talk raw, and we know our community, and that's why Impact was founded, because we wanted to make sure that we can have a voice, and our voice would be pure.
We appreciate the opportunity and appreciate having you here.
Thank you, Ed.
All right. When we come back, we'll talk about voting for your health. Back in a minute. America still finds itself in the midst of the COVID-19 pandemic, a pandemic that has killed more than 200,000 Americans. In that number, African Americans are disproportionately represented. During the pandemic, the media started to pay attention to the fact that African Americans were being killed at a greater pace than other racial groups. The truth is, COVID deaths among African Americans are just one example of Blacks being impacted negatively in health areas. Questions remain about Donald Trump's response to the pandemic and concern about if America is ready for a predicted second wave of infections. As we face this ongoing scare, does it matter who's in the Oval Office, and can your vote make a difference in correcting the imbalance in healthcare that has plagued Black America long before COVID. Joining me, Edward Cornwell, MD, a trauma surgeon. He is also professor and chairman of the Department of Surgery at Howard University. And Dr. Chris Purnell, MD. Dr. Purnell is Chief Strategic Integration and Health Equity Officer at the University Hospital in Newark, New Jersey. She also has a very personal connection to the corona pandemic. We'll get to that in just a moment. I thank you both for joining us. Greatly appreciate it. Dr. Cornwell, let me start with you. When we look at the pandemic, we have seen people get a little used to our life right now. Give me a sense of how you still see this pandemic impacting not only America, but specifically Black America.
Well, it just adds to the roster of diseases that we see have demonstrate what we call health outcome disparities, both in frequency and in outcomes once affected. As a trauma surgeon and as one who does emergency surgery, and as a department chair, we're not surprised about a host of diseases that impact Blacks that explained by the lack of access related to health insurance status. It's as fundamental as insurance status is the first step to try to narrow down these health disparities.
Dr. Purnell, we should note, I said in the introduction, you've had a very personal relationship, if you will, with this pandemic.
Yes.
Can you explain how it's hit your family and you and how you see the overview?
Right. So when we say that the coronavirus pandemic has disproportionately impacted Black and brown lives, I often point to my own life. Surreal. Here I am working in one hospital in Newark, New Jersey, and just mere miles away, my father is fighting, struggling for his life because of coronavirus. And ultimately, he succumbed to the illness. And in addition to losing my dad, my sister, who's a breast cancer survivor, she got exposed and was infected in late April. Actually, she tested positive the week that we did his virtual services. And she has struggled to recover. She's what we call a long hauler. So it's no myth that this pandemic has been brutal and devastating on Black lives. Just look at my life personally.
Dr. Purnell, let me stay with you a moment and give me a sense of how you see, as we are in election season, the opportunity to connect the dots in terms of voting and demanding after these votes what must be done beyond the pandemic. As we say, African Americans have struggled with equality in healthcare for a very long time.
Let's start with this. Look, voting is what we call a part of civic health, right? Civic engagement is fundamental to our health and well-being because we know that the majority of what influences health outcomes actually has very little to do with your interaction in a healthcare setting, right? So voting impacts economics, voting impacts your neighborhood, voting impacts access to education, voting impacts the environment and clean air. And what the coronavirus pandemic has taught us, and it's just so important for others to reflect upon this in this election cycle, is that racism truly is the pre-existing condition. And what this pandemic has shown is those cracks in society that racism and other forces akin to it have become earthquakes.
Dr. Cornwell, let me ask you as relates to that same issue, particularly someone who has worked at Howard University for as long as you have. You understand the politics of medicine. Give me a sense of what we should tell people by understanding their need and want to go to the polls and then demanding what that vote should give them by means of health care.
I think you could draw a line to just our last 50-year history. There's been 13 presidential elections since President Johnson signed the Voting Rights and the Civil Rights Acts. And if it were not for minority voters, there would never have been a Democratic president. In other words, the Republican Party has won the majority of the white vote in each of those 13 elections. However, in 7 of the 13, Democrats won the popular vote, meaning that Black voting made a difference in close elections. And you can look no further than the state of Mississippi, our blackest state, 37% Black, but with low voter participation, lowest, some of the worst among Blacks. So the failure to exercise our political will, strength where we do, literally costs lives.
Dr. Purnell, I understand that you are participating in a vaccine experiment for what we hope will be a cure, or at least a combative to all of this. Give us a sense of what you've been doing.
Sure. I'll start by saying my dad frequently used to say to me, my dad was a research scientist, and he would frequently say to me, follow the science, follow the data. And so as a public health physician, I believe in public health science, and I have been attuned to the public health data. And I felt that this was my way to live and work out my accountability in my community, my accountability more broadly in the field of public health. And this was a way for me to live out my father's legacy, right? My father's death and my sister's experience truly put a fire in my belly, and participating in what I hope will ultimately lead us to a solution was my way to live that forward and to turn the situation around, one from a lack of hope and one from that it's been dark and dismal to one where we are hopeful and one with illumination.
How much frustration do you see when we have a White House, at least a leader in it, who isn't following the science, who has decided to just go with a gut or go with a political sway versus following what the scientific community may be saying?
Very frustrating. It's frustrating to me as a public health physician, and it's frustrating to me as an American and as a Black woman. Look, when politics gets in the way of the data and when politics gets in the way of the science, people lose lives. We have over 200,000 Americans who are dead. That's more Americans that have died in every war that we've participated in, except for World War II and the American Civil War. That's a travesty.
Dr. Cornwell, finally, I'll ask you the same kind of question. The idea of politics and science or medicine standing side by side can sometimes be problematic. As you look at the 2020 election, what do you want people to understand?
It's pivotal. I think you'd have to say probably 1868 the most important, 1876 after that, when Rutherford B. Hayes brought the federal troops out of the South, and this is right up there with their number 3. Dr. Purnell's father must be proud of her. So I would say as a scientist also, that we got to hang on. We got to hang on because the science, we can see in very real ways, just by doing multivariate analysis of clinical records, the importance of health access to gain health quality. Without one, you won't have the other.
Doctors Cornwell and Purnell, I thank you very much. Greatly appreciate it. And my best to your family, Dr. Purnell. Greatly appreciate it.
Thank you.
Thanks very much.
Thank you.
When we return, does the loss of RBG on the Supreme Court mean Obamacare is on life support? Can you vote yourself better health care? Our panel joins me when we return. Time to turn to our panel. Today, I'm joined by Joe Watkins, former White House aide to President George Herbert Bush, Temple University professor Mark Lamont Hill. His new book, We Still Here, Pandemic, Policing, Protest, and Possibilities, will be out next month, but you can pre-order it right now. And Democratic political strategist Aisha Mills. Thank you all for joining us. Greatly appreciate it. Let's talk a little bit about whether or not you see Donald Trump's handling of this pandemic as the biggest swing issue, if you'll allow for that, for this election. Joe, how do you see that?
I think it's a big issue. I think if it is the biggest issue, then it hurts the president because of the handling of the 200,000 deaths that we've seen to date. I think a lot of people are dug in right now in terms of how they're going to vote in November. So there's not a lot of room at the margins. I think people are pretty well decided on who they're going to vote for come November 3rd. And in some cases, they've already voted. So they know what they're going to do. But there's room, I think, at the margins. And I think that in the coming weeks, we'll see a continued play for suburban women. And to the degree that this pandemic weighs heavy with suburban women, you'll see that as a key issue in this campaign.
Mark, Joe brings up something interesting, and that is, for the most part, I think it's fair to say that the majority of people have decided one way or the other. So are we actually playing for swing votes, or are we just simply playing for turnout, or on the Republican side, strategy in the Electoral College?
I think a big part of this is playing for turnout. There are very few people weeks before any election who are really undecided. But given the polarizing nature of Donald Trump's presidency, given the strong unfavorable and favorable ratings that he gets from his respective camps, it's pretty clear that people already know what they're going to do. The question, though, I think, is can we energize Black voters to come out and vote at a high rate? Can we make sure that the provisions are in place so that people who are economically vulnerable, for example, 40 million people are struggling and facing eviction. The idea of a mail-in vote is somewhat, fuzzy there. How can we get people out to the polls? Can we make sure that write-in votes and absentee ballots are protected? These are the questions that I think are more sort of interesting than can we convince someone who's not supporting Trump to suddenly support Trump after everything they've seen in the last 3.5 years. And conversely, if somebody is pro-Trump, they've already decided that they don't care how the pandemic was handled. They don't care about the economy. They don't care about the kind of epidemiological dangers we're facing. They've made their choice.
Aisha, let me ask you this. The civil unrest notwithstanding, you look at the pandemic, you look at 200,000 lives, disproportionately in that number are deaths of African Americans and people of color. What more do you think it's going to take to get people to make sure that they go to the polls? Because I'm still devastated by the fact that I actually hear some African Americans say they're still not sure whether they're going to go to the polls.
Well, yeah, I mean, here's the thing, Ed, that's exactly why Hillary Clinton lost last time, is because there were people who were on the fence, they were ambivalent, frankly, they just didn't like her, they weren't inspired to engage. But here's what I am looking to see play out around this pandemic. You just noted that disproportionately the numbers are hitting the African American community. 1 out of 1,000 Black people have succumbed to COVID, have died from COVID over the last 6 months. 1 in 1,000. That is a significant number. And what we know is that the banter on all the media stations aside, people are sitting in their homes. They are grieving lost family members. They themselves are afraid to send their kids to school. They are affected because they may be frontline workers who have to go to work and put themselves in harm's way regardless. And so I think that people are really feeling the actual personal pain of this pandemic, specifically in the Black community. And I am looking to see and hoping that then that prompts folks to feel motivated to actually engage and participate this time. We're talking about lives lost and deep economic impact. Those two things together are certainly inciting people, on top of the fact, like you said, that literally Black lives are still bleeding in the streets, and we are demonstrating because we're in such pain, but we're not going to be silent anymore. And I'm hoping that that translates into fervor at the polls, because the numbers, the margin of error there for the Democrats is so thin. If Hillary Clinton would have gotten, 50,000 more people in Milwaukee or in Detroit or even in Philadelphia, the outcome could have looked differently. And so that matters. The turnout certainly matters. And I think the pain is absolutely going to push people.
Aisha, let me stay with you on this one, and that is a question of that turnout. Strategically, it seems to me that Democrats have been outplayed for a mighty long time by Republicans. There is still concern about losing the popular vote, but having, a road to the Electoral College.
Black people have to show up and vote. Black people are the difference makers here. When we turn out enthusiastically and in mass, it absolutely changes outcomes in the election, and Democrats ultimately win, Black women in particular. The thing is, and this is what Joe Biden and the Democrats need to do, is that they need to give Black people a reason to vote. And you have to speak to them and give them a reason to participate and a reason to show up, especially for the Democrats in this sense, because Donald Trump is just horrible for Black people. What often has happened is that there's a lesser of the two evils kind of attitude with voters who maybe aren't the ones who show up every time because it's just what they do. And that's not going to work. That's not going to work this time around.
No, Mark, let me suggest with only a few weeks to Election Day, I don't see that kind of fervor. I don't see anything in large numbers in our community more than I see the idea of anybody but Trump. So on November 3rd, is that going to be enough?
If you were to ask me at this exact moment, I'd say we don't have enough. There isn't enough fervor, there isn't enough energy. We saw some really interesting mass voter registration movements a few weeks ago that I think were helpful. They were very effective at getting people registered. But getting people registered is one thing. Getting people to the polls on that day is going to require more than anything but Trump. People will hold their nose and vote for the Democratic candidate if they're committed to going to the polls. But there are people who still need to be convinced that their lives will be substantively different when they get to the polls. Now, my argument is go to the polls, Black folk. Go in droves, bring everybody you can find, because we have to end the fascist presidency of Donald Trump. We have to do that right now. So I'm not equivocal about that, right? However, for many people, when they hear Joe Biden not say enough about what he's going to do for healthcare, when he doesn't support Medicare for all, when he doesn't support the Green New Deal, when he doesn't support defunding police, there are people that feel like, oh, this is all the same again, and they won't vote Trump. Black folks smarter than that, but some folk may not feel the energy to come out. So we have to, as Aisha said, we have to make them do that. Joe Biden and his campaign have to be committed to raising their voices loud enough and articulating an agenda powerfully enough that people are compelled to come out and work.
I think Mark and Aisha both made really excellent points about the importance of turnout in November and the importance of people showing up to vote and not taking anything for granted. And that's going to be the big challenge, certainly for both sides going forward. I think maybe less so for Trump's side. I think that on the Trump side of the aisle, there's which doesn't have very many blacks, by the way, as we all know. I think there's a lot of motivation on the side of his base to come out and vote. The question becomes will that be the case on the Biden side of the aisle? And Biden needs an Obama-like turnout, especially of African-American voters, to win this. I think Aisha was spot on when she talked about the percentages that are needed, and that nothing can be taken for granted. I think that he needs that kind of a turnout. It's not good enough for him to get 85% of the black vote, because that won't necessarily win it for him. He needs probably 92, 93% of African Americans to vote for him, and in large numbers. And Donald Trump will continue to work to shave off a few percentage points here or there, although the first debate performance won't help him with African Americans at all. It won't help enlarge his base of support among people of color. But that being said, it's going to be a dogfight right down to the end, and turnout matters, and the energy of both camps and the capacity of both camps to turn out their voters on election day is really going to matter this time. So it's not just a matter of whether or not you pick up the phone and in a poll say you support candidate A or candidate B. It's a matter of actually showing up at the polls to vote for that person on election day.
Let me throw this out to all of you. And this is a subject that really doesn't matter who wins because of the political play Republicans have been able to do with the Supreme Court, with RBG's passing and that seat being vacant. Mark, do you think that this means the end of Obamacare as we know it? And what does that mean to our community, if anything? Because as everyone said, Obamacare was not a panacea.
Well, yeah, that's an important place to start. Obviously, many of us on the far left would like to see is a universal model, a Medicare for all model that would make sure that everyone has a level of access and that ends private health care. But absent that, with a 6-3 majority in the Supreme Court, we certainly see ACA or Obamacare very much vulnerable. I don't want to say it's the end of it, because the end of Obamacare is as much, or the challenge to Obamacare from Trump and others is as much about ideology as it is about the political kind of appearance of it. In other words, when you ask Republicans, most Republican voters, what they like about what they oppose about Obamacare, and you go itemized point by point, they tend to like all the stuff in Obamacare, and so it's quite likely that if Republicans can repackage it, you'll see Obamacare by another name, and they'll take credit for what Obama ultimately was able to achieve in 2010. And so I honestly am not certain that's the end of Obamacare. I will say, though, that if ultimately it comes down to a Supreme Court vote, and we see the court stacked in the way that it is, and it looks very, very, very grim in terms of resisting this appointment, then I think we are going to see some major challenges to Obamacare from the highest court in the land.
What the Republican strategy has long been is to dismantle any sense of equality and progress. They spent 20-something years actually moving the Democratic Party more to the middle. This was all part of the Clinton era and the Blue Dog Democrats, et cetera. Now they're saying, well, heck, we feel like we have an opportunity to just ram through every single extreme, crazy right-wing ideology that we want to, and they're going to do that. So I think surely Obama becomes a symbolism for them to gin up their base and to attack, and so Obamacare becomes a part of that. But if you watch what has happened in the absence of Obama and still Pelosi holding the gavel, they are just going to block anything that the Democrats want to do, because it really is about a power grab at this point. They see an opportunity to shift our nation for a generation. They are trying to put forth a woman because they want a woman symbolically to repeal Roe versus Wade. We've already lost on voting rights in the Supreme Court, so I would not be surprised if they do something that really makes it just awful for Black people to be able to access the ballot and to perpetuate voter suppression. There's just so much there that to me is a vile Republican, very white, right-wing agenda that they're pushing, that Obama got to be something for them to attack, but it is bigger than that. And we've got to, the last thing I'll say to put a fine point on it, we have to remember that everything we're seeing play out right now is symptomatic of a broader structural and right-wing America that has been in the making, frankly, since our founding, but certainly over the last 20, 30 years. And what we're seeing now is that work of 20 and 30 years bearing fruit. Donald Trump just happened to be here at this moment in time and was the one who was kind of a catalyst for it all ultimately to come to pass. But this ain't new, and this is going to continue.
Well, we will certainly see in just a few short weeks. Mark, Joe, Aisha, thank you so much for joining us. Greatly appreciate it.
Thanks
so much, Ed.
As I said, we're just a few weeks away from Election Day. Will Donald Trump become a two-term president, or will Joe Biden become one of only 13 men who served as vice president and president? We'll soon know, and it may not be without controversy. No matter, you will help determine the outcome. Just make sure to do it in the affirmative way by voting. Join us next week as we look at an area Blacks have arguably made the least progress in. Wealth and equal employment have remained elusive for many people of color. Will the 2020 election change any of that? We'll take a look next week on Impact the Vote. I'm Ed Gordon. Thanks for joining us.